Hello, everyone. Thank you for attending today's webinar, Reaching Medicare Advantage Beneficiaries and New Customers Through Technology. For this, we'd like to thank our sponsor, Untitled. I'm Julia Douthart, Director of Content for Fierce, and I'll be moderating this webinar. Today's speakers are Christine Leo, Senior Director, Medicare Product for Cigna, Claire Cruse, Chief of Staff, Deloitte Center for Health Solutions and Deloitte Health Equity Institute, and Carissa Steinrye, Vice President, Clinical Strategy for Untitled Health. You can read their full bios on the left side of your window by selecting the Speakers tab. So, just a few technical notes. This webcast is being streamed through your computer. There's no dial-in number, so for best audio, please make sure that your volume is up. The webinar is being recorded and will be available on demand within 24 hours after the event. And then, time permitting, we'll follow the presentations with a Q&A session. So please submit your questions using the questions and answers tab on the left side of your screen. So without further ado, let's begin. Claire, go ahead.
Hi, thank you so much for having me here today. I'm Claire Cruse. I am, as Julia mentioned, the Chief of Staff for the Deloitte Center for Health Solutions and the Deloitte Health Equity Institute. The Deloitte Center for Health Solutions is our research and thought leadership think tank for the life sciences and healthcare industry at Deloitte. And the Health Equity Institute is our pro bono arm that works with external organizations to do collaborations in this field of health equity to advance and activate health equity amongst underserved populations. So today I'm going to be talking about Medicare Advantage and some of the trends that we're seeing that are building into and really setting up Medicare Advantage for massive transformation into the future. So I'll move to the next slide, hopefully correctly. There we go. So at Deloitte, we've been exploring the future of health. And when we talk about that future, we're really looking down the road to 2040 and projecting the trends that we're seeing today and trying to predict where we might be in about 20 years. So we know that that's hard to predict, but we believe at a very basic level that by then consumers and their data will be at the center of the healthcare ecosystem. And that more importantly, healthcare will have become health. And so as that shift starts to happen, we know that healthcare organizations themselves will begin to shift away from treating and managing disease and towards sustaining health and well-being of their populations and their members. So that shift will have profound impact for all stakeholders, but also for people as they age. We know that already today, people are living longer than ever. But as Dr. Laura Carstensen once said, the years we've added to life have not actually been tacked to the end of it. Rather, we've seen the middle aging of society. Those years were really tacked to the middle of life. Unfortunately, healthcare organizations and many of the operations, the traditional operations of healthcare organizations haven't quite caught up with this. We also still see that average health span is stopping well short of the average lifespan. About 10 years is the average, but again, that can vary significantly as we all know when people start to age. So what I'll ask you to think about as I talk is, what would happen if we actually extended the health span of populations? And I'll talk about some of the implications as we get there. So as we think about the future of health, where health span is really extended to mirror lifespan more closely, we know that that's going to have drastic impacts on how healthcare organizations operate. So these three kind of buckets of the conversation is what I'll focus on here. In the future, again, we believe that care will be everywhere. It'll be enabled by IoT, smart devices, wearables, precision well-being, and micro-interventions will be the norm. It'll be enabled by data and AI. What this means is we're really going to start to see a shift away from treating hard diseases, the things that are really driving a lot of costs in the system today: diabetes, heart disease, cancer. And while it's really unlikely that we'll see all disease eradicated in the future, for example, we're sitting in the middle of a pandemic, We really think that some of the soft diseases like depression and loneliness and social isolation, these are the epidemics that we're really going to have to shift into focus in the next decade and into the future. At the same time, as we see people living longer, we can predict this will really have a strong impact on how people work and retire in the future, and thus how they select and choose their health benefits in the future. So if the healthcare system was really focused on preventing disease, keeping people well longer, we could see more people working past the traditional retirement age because they want to. Right now, we know many people work past it because they have to. Age-Friendly Advisors has actually been looking into this and surveying older workers to understand why they're working beyond the traditional retirement years. And their recent survey found that 64% said that they are working still because they both want and need to. And only about 20% said they're working still because they have to. So really interesting implications as we think about enrollment in health benefits and employer benefits and Medicare Advantage. Lastly, as we consider this future, we also know that it's going to have drastic impacts on the way that people live in their homes and communities. So we can envision a future where more ubiquitous Internet of Things are enabled through homes. People's homes are so in tune with their daily work and routine that they do a lot of the work for you. We also could envision that this would extend beyond the house and into communities. Transportation systems could be automated and actually assist people with that last 10 steps problem as well. One of the interesting, I think, issues that we face today is even though we have Uber and other technology systems that enable people to get transportation more accessible, in some ways, there's obviously some populations that still struggle to access those. It still doesn't help us with that last 10-step problem. If someone can't get out the front steps of their house to get into an Uber, then it's going to be very difficult for them to actually access that transportation. So as I move to the next slide, I'll talk about what this means for today's Medicare Advantage plan. What will they need to do in order to find themselves a place in this new world order as it pertains to their members' needs? So a few things to think about as we kind of look forward to this future. So we can expect steady enrollment and growth in MA as we're already seeing for the next decade. We've done a lot of research to understand what the trailing edge and leading edge boomer populations look like. We know that the trailing edge boomers are even more likely, and that's the second 10 years of the boomer population. That's still about halfway through the enrollment stage for MA. We know that that population actually looks pretty different from the leading edge boomer population. We've done a lot of research to actually understand some of those key differences, and I can share that with you if people are interested. So we know we'll continue to see enrollment from that population. We're also seeing digital solutions become table stakes for members as they enroll in Medicare Advantage. So we saw before COVID-19, many MA plans were increasing their adoption of digital solutions, but many were further ahead than others. And, again, we've seen that accelerate throughout the pandemic, both in the benefit area, so in care and medicine, but also in the enrollment space. So lots of digitalization of the enrollment process as well. Some of that has been driven by consumer demand, but I think interestingly, at the same time, it's also been driven by health plans understanding that they want to keep their members out of the physician's office, but still cared for. As we saw, one of the worst places for many people to be during the COVID-19 pandemic was actually in a healthcare setting because it exposed them even more. And then finally, COVID-19 has really moved the drivers of health, what we call the drivers of health, many call the social determinants of health, but it's those non-medical factors that have a very strong impact on a person's health outcomes, economic, environmental, social needs, that those drivers of health have moved from the back seat into the passenger seat, as one person I once spoke with in this space said. So this has come a lot into the space of expansion of supplemental benefits. We see a lot of that flexibility from a regulatory perspective, and many MA plans starting to take advantage of that. What's also really interesting in this space that we've been following is a lot of the organizations and the companies that MA plans are starting to partner with and work with to support their members' needs in this area. So one example of that is Healthify, which works to identify populations that need additional support And what I think is particularly interesting about their solutions is that they have they've designed accountable networks of community-based organizations to tap into and actually support their member needs. So they're not building things from scratch. They're really using the digital enablement and adding it on to the community-based organizations who've been working with many populations for years. So, but before I end, I want to leave you with two questions to consider as we think about some of these trends. I brought it up a little bit earlier, but I think a really important question that we should think about as we think about tackling members' needs and Medicare Advantage and really starting to think about the digitization of members' needs is the opposite of digital, the analog. How critical is analog in the digital age? I think COVID-19 has really, really put a spotlight on this. And we actually did research before COVID-19 and kind of pitched this question up to think about. And then we had this really interesting, awful time period where we've seen virtual everything and the impact that it can have on a person's life. So in particular, the older adult population has really been adversely impacted by this. They were the first population to say you must lock yourself in your house and not leave because of the danger. And, relying on virtual services to supplement or take place of many of the things they did in person, this has had a really strong impact on social isolation, depression, and loneliness. And that's not just amongst the older adult population, but really everyone. We're not going to offices. We're socially distancing. We're staying close to home. So we've really seen kind of this experiment of what the virtual age might look like and how the epidemic of loneliness might get worse in this. So that balance of analog and digital, I think, is a really important question to consider moving forward. And then the other question I think is, again, another one that we really saw highlighted and emphasized throughout this pandemic is the caregiver burden. We think about caregivers as people taking care of older adults, but we're also seeing it in many other populations as well. But MA plans are definitely responding to this and seeing this need. I think there's still a pretty big gap. As of the latest data that I saw, only about 3% of Medicare Advantage plans are offering caregiver support in 2022 as a supplemental benefit. So clearly a large gap that needs to be met at some point in the future and will only probably get stronger. And then final note I'll leave you with is I want to emphasize the shift in focus that we're seeing in health equity. So this has come directly from the CMS Innovation Center itself. Recently refreshed its strategy and has announced that health equity is one of the 5 strategic objectives that it will guide its work in the future. We also see it playing out even as recently as last week through the recent announcements like the proposed advanced notice for MA and Part D plans and proposing updating the star ratings to account for how well a health plan tackles health equity. So this is something I know we're going to see a continued focus on from the CMS and Medicare Advantage regulatory landscape. Something that we all know, health equity only impacts a person more strongly as they age. So when you think about the intersection of many issues, they only get more stronger as a person ages into their older years. So definitely something I think we'll also continue to see a focus on into the future. So with that, I will end and I will pass it back over to Julia.
Excellent. Thank you, Claire. Next up, Kristen Leo, Senior Director, Medicare Product for Cigna. Christine, please go ahead.
Thank you, Julia. We at Cigna in our senior solutions area offer Medicare Advantage, Medicare Supplement, and Part D plans. What I'm going to talk to you today about is Medicare beneficiaries and technology. A lot of the things that I'll talk to you about touch all 3 lines of our business. Some of the solutions only touch Medicare Advantage, but again, certainly have applicability across the other lines as well. So, to start out with, the adoption of technology amongst older adults has really grown exponentially, probably in the past decade. Really a lot driven by online shopping and social media and social connections. I'm personally not that far. I'm one of those trailing boomers. I think I'm the last year maybe to share with you my age. And as you can see, I'm pretty technologically adept. I'm here doing this webinar today with you and able to connect and figure out all the logistics of firewalls and whatnot within my company to get here. But again, many seniors are extremely adept at using these services. Many of them have, multiple devices within their homes. My 92-year-old mother-in-law, very adept at texting, using FaceTime, using Facebook, emailing, using televisits and whatnot. So again, not something that's going to go away anytime soon. I think, as Claire pointed out, the pandemic really accelerated this. The need for telehealth hastened the need for people to understand how to use technology. And it has really overcome a lot of the initial reluctance that many seniors may have had in using technology and having satisfaction with having telehealth visits. In short, our world as we knew it 2 years ago is forever changed, and I think forever changed for the good. It just creates many more points of access for seniors. It helps caregivers, makes things easier. Sometimes it makes things more complicated, but overall, it helps improve access to healthcare. There's a lot of self-service opportunities within the world at Cigna. We offer virtual fitness tools and applications, trackers. People are using wearables, things like, smartwatches and other devices to track their activity and keep them, I don't know why I flipped back, to keep them moving and staying active. This helps their mental state. It helps their overall physical health, and we are all about the whole person health. We also have applications and text reminders for transportation. Most of our plans offer a transportation benefit for people who need to have those brick and mortar in-person physician visits, but also to get to the pharmacy. You can also order your drugs online via our home delivery pharmacy. So it just makes things convenient. Seniors can do things when they want to do them. It's not necessarily this has to be done between business hours 9 to 5, Monday through Friday. But if they remember at 11 o'clock at night, which is frequently when I'm taking care of things, I can go in and take care of those items online and easily, make sure that things keep moving in the right direction to keep my family and myself healthy. We also offer over-the-counter items, which can be ordered online, again, at the convenience of when it is important for the senior to do it or when they remember to do it. Medicare Video Learning Series. We have fitness videos online and other health activities online for seniors to participate with. We also have a benefit that offers pals to come in and hang out with seniors and take them to the grocery store, play cards with them, do some light housekeeping. Seniors can schedule that online. These pals also come in and can help seniors with their technology. So how to set up their MyCigna app on their phone, or if there's a pharmacy app that they need to have on their phone, how to get that set up, how to work in Facebook so they can connect with family members, how to use FaceTime if they're using Apple phones, and how to have virtual visits with one another. So it's a really great benefit, and it provides some additional support for seniors within their community. I talked a little bit about telehealth, and we offer telehealth on all of our plans for primary care, urgent care, as well as specialty care. We also offer behavioral health, speech therapy, and physical therapy. The therapies are something where we offer them as supplemental benefits because right now they're offered via the PHE. CMS allows them. However, once that is officially over, the regs need to change. Speech therapy and physical therapy both lend themselves well as good options for customers to, they're things that need to happen frequently. They're good options to allow customers to have a different point of access. It frees caregivers and family members up from having to take people to appointments. I know in our family, my mother-in-law is going through physical therapy, and it's always a challenge of who's going to take her, who's going to pick her up. And it frees us up by allowing her to have those virtual visits with her physical therapist. We use both our contracted providers and our own company, MD Live, to provide many of these services. And again, it has just been, we have had overwhelming support for this. We have many of our physicians who are now adding on their after hours line, reminding customers that they can call MD Live for after hours care to try to divert care out of the ER and the urgent cares when appropriate, rather than the person going there when they can't get into the physician's office immediately. So again, just really has been a boon to us. We have seen it trail off a little bit with the pandemic easing up a bit. I will say personally, having used telehealth, it's not for everything, but there's some services. I've actually told my physicians they're never going to see me in person again unless there's some absolute reason I have to be there. It saves me an hour time in travel. It saves me $20 in parking. The visit's over in likely 10 minutes with wearables and other connected devices. They can read and understand what's going on with me or with another patient without having me actually come into the office. So again, a really efficient alternative. It allows them to also see more patients. The other thing that we've heard about this is telehealth provided a great opportunity for some physicians to augment their income. For physicians who maybe are retired and who want to do a little bit of work, it allows them to keep their hand in. It also allows some physicians who have we have one physician on our staff who suffered a serious accident, became a quadriplegic, and is now still able to take care of patients via telehealth. He has someone scribe for him, but it's an excellent opportunity. And again, just provides so many additional points of contact for customers. We also have our website, My Cigna, our customer portal, which allows customers to review their benefits and coverage. They can print ID cards, look at recent claims, determine their drug coverage, their drug costs, where is the best place to get a prescription filled, look for providers, make premium payments, register for incentive programs. Again, a really great tool for people who are comfortable online. And if they're shopping online, they likely have other, they may have accounts with their credit card companies or other companies that they deal with on a regular basis. Maybe they're utility companies. And it's just a really great way for people to be efficient in their lives, to get information when they need it. For the health plans, it certainly helps us because it reduces call volume to our call centers. We're still there when you need us to be there, because online doesn't always work for everything, but it makes things substantially more efficient. So again, a really, really great, great option for folks. I think our key learnings really is that the tools have to be easy to learn. They have to be intuitive. Again, all these tools can help caregivers and others to help seniors adopt using these tools. There's always going to be a percentage of people who are not going to use online, or it's not right for a certain service. We're really just starting to scratch the surface. There's so much more we can do, from wearables, live texting interactions, chat functions, I'd say AI to identify customers who have specific needs based on things that happen. I've seen some recent demos of products that can pick up just listening to a customer's voice, where there may be an issue going on that would alert us or alert a physician to do some outreach to a consumer. So again, I think the sky's the limit here. I think we're going to continue to see a lot of change, and I am really excited to be a part of this. Thank you.
Oh, thank you, Christine. Next up is Clarissa Steinreich. She's the Vice President, Clinical Strategy for Untitled Health. Christine, please go ahead.
Thanks so much. This has been great conversation. And Claire, I'm still thinking about what Claire said at the beginning of this conversation around the idea that we've, that the years that, how did you say that? The years that we've added to life have not just been tacked on to the end of it. And when you said that, that really resonated with me. I think it's a really meaningful idea when we think about the member lifetime value and what that means and what that looks like. And that's something that's really near and dear to me. I'm a social worker by background, and I've spent 15 years plus in clinical leadership with health plans, and definitely sort of being able to provide that personalized experience to someone, and driving that level of connection with individuals to really be able to interact with them in a meaningful way to help make those healthcare changes has been just something of great interest with me. And so I mentioned that I'm a social worker and have been in the healthcare field, but I'm now the vice president of clinical strategy with Untitled Health. And I was actually a former client of Untitled. And really what attracted me to the company was the why, just the why behind what it is that we're doing. As a company, why do we exist and what are we here to really try to solve? And, if you ever have a chance to hear our CEO, Enam Noor, talk about his experience coming here and kind of seeing our fragmented healthcare system, you'll hear the passion that he has for really being able to kind of connect all the fragmented data and the data silos, and that just being a big part of his why for creating the company and starting this company. And so we see a real challenge in healthcare in terms of data silos, and they're not being this good ecosystem to drive kind of that personalized experience that everybody has been talking about today. And really being able to drive that personalized experience, it goes a long way in impacting someone's kind of lifetime, that member lifetime value, and also just, their experience with the health plan and the healthcare system in general. And so that's really why we sort of developed our company and our platform, was to connect those siloed data sources into one holistic ecosystem, so that we could help to drive insights that personalize that healthcare journey. So how do we do that? I have no magic wand, and there's no kind of one size fits all way to do this. But what we really have kind of challenged ourselves to do is to make the process a very kind of simple, easy, and effective one is how we present that. And so the idea is that we're a simple connector. So we really don't want to disrupt a health plan's current processes, workflows. And I know as a customer, for me, it was really important that my care managers and non-clinical staff were able to leverage the insights of the platform without leaving their native system. So a key tenet of ours is to keep things simple and to not disrupt workflows, and to really create API integrations or single sign-ons in the native systems that you have. We don't want to be someone who is sort of disrupting that. So we just want to sit on top of your existing workflows and really kind of improve those and make those workflows better. And that ultimately is meant to drive those optimized results. And then from that kind of easy perspective, we're looking to connect the data ecosystem and provide you with some insights, whether that be in a dashboard, but that are very much in real time. And that are personalized reports, and that are not generic in nature, and that they're happening at the cadence that is right for you and your consumer. So whether that be a daily, weekly updated view of kind of what's going on in your world, that's something that we really want to make happen for you. And so our AI system and our decision engine drives kind of day-to-day decisions for the plans to create personalized interventions for their members. And we really take an omni-channel approach. So that could be delivery via mail, telephonic, texting, whatever that may be, because as I think we've heard throughout this conversation, our consumers, our members, they want to be able to access that data where they want it, when they want it, and how they want it. So gone are the days of just kind of I've heard it called spray and pray. Like you just throw all this information at people and say, hey, close this care gap and, see the PCP, and you throw all this information at them without necessarily coordinating it or really doing so in a meaningful way. And I can definitely say that's something I've experienced, in the health plan world. And so the idea behind that is when we make the process simple, when we make the implementation, a quick, painless one that lasts 6 weeks or so, and we provide that real-time insight, you really can improve then member satisfaction and that member experience. And it's when you improve that member experience that you begin to see loyalty amongst your members, and you start to see that churn reduce and retention really grow. And that's important when you think about how we help to drive member change. The greater loyalty that a member has with the plan, the more that they begin to not need the constant sort of communication. They know the things to do. They know that at the beginning of the year, have the annual wellness visit, and they know those important care gaps to close because they've been part of that process and part of your sort of health plan family, so to speak. And so it allows that communication to be much less abrasive and just allows that healthcare journey to be a much more meaningful and personalized one. And lastly, then, we really try to push the insights that we learn. I think about social determinants of health data. That gets looked at a very aggregate level. So perhaps a zip code might suggest that someone has a food insecurity issue. But when you reach out to them, you find out that that's not something that is realistic for them. That may not be a barrier that they're experiencing. And so you want to refine that. You want the system that you're using to continue to learn over time so that you can continue to make that communication with your members be more just as personalized as it can be. And so kind of how do we do that, and what does that look like? So we're in CIGNA'S and the Engage platform. It's a cloud-based data connector. And again, the idea is to really create those real-time insights to drive that personalized consumer-centric activity and messaging. And our goal is to really help plans improve profitability and increase the member lifetime value. So at its core, we're a SaaS platform, we're a tech platform, and we can sort of bundle everything together in that way. And it's cloud-based. And we've done a really good job, I think, from the get-go of ensuring that data security is a big part of things. So you'll see here that from the jump, we wanted to make sure that we were high trust certified, NCQA compliant, pre-validated, to ensure that we can support customers' workflows and really, help reduce any kind of red tape. Some things that I think are, that I know I'm really proud of in terms of being an employee of this company is that we support over 35 health plans, and we have about 21% of the market share in the Medicare Advantage space. So it allows us to work with our clients in a meaningful way and share really great best practices. So we have plans we have small chronic condition SNP plans and all the way up to large national plans with over 6 million members. And I think those are the main things that I wanted to sort of say about the work that we're doing in this space. But would definitely love to hear from anyone if we might be able to help you in that space. And I know we have some Q&A, so I'll go ahead and turn it back over to you, Julia, to take some of the questions from the audience. Thanks.
Thank you, Clarissa. Okay, so there's still some time to submit questions. It looks like we've got quite a few in here, but if you want to get one in, we might be able to get to it using the Q&A tab on the left side of your screen. Just type it in there and it will come to us and we can take a look. So far, we have a lot of questions about whether people can watch this again. So I'll give you some information about how you can log in later and log back in and take another look or share if you'd like. So, okay. All right, here is one. So we've heard a lot about technology. This is to the panel, I think. We've heard a lot about technology adoption and and how it's improved the experience. Are there instances where it serves as a barrier, and how do you manage that?
I can jump in with a couple of thoughts just off the top of my head. So, I mean, I think it goes back to the points I was making at the end of my slides, talking about health equity and thinking about how the many compounding factors that make up a person, age is just one factor of a person. Lived experience is also another one. And I think that is where we see these barriers start to come out, is in the space of what do people have access to? Technology is a wonderful thing, and it's helped to democratize a lot of services and a lot of experiences, but it's also really still only available to those who have technology. There are a lot of, on the other hand, lots of assumptions we've made about certain populations as well. I think all of us have spoken about the bias or the misconception that older adults don't like to use technology. This is certainly not true, and it's not true not only for the older populations, but also for the younger populations. We're seeing a lot of differences in people's interest in using technology, and many older adults are actually more interested in using technology than some of the younger populations, according to our research in this area. But I think, again, when you talk about a population who may access technology in a different way, that is when these barriers start to come out. The thing that the analogy I always like to make is it's not a technology analogy, but I think it helps us think about these issues in a technology space, is when I think about the sidewalks outside of my house. Where I live, the sidewalks in my house are about half the distance or half the width than a normal sidewalk. So a person who's pushing a stroller down the street might fall off. A person who's in a wheelchair might fall off that sidewalk because it's not full width. If you expanded that sidewalk, it would meet everyone's needs. It would meet the person who doesn't have accessibility differences, that walks down the street. They can still use that sidewalk the same way, but it also meets the needs of many more populations who have different needs. I think we need to think about technology in the same way. You think about the very basic things like the size of fonts on screens can actually make a huge impact, especially when you think about someone who is older and has sight issues. But older adults are not the only ones who have sight issues. Younger people also have reading difficulties looking at smaller text. So again, I think about these terms, and what I think is helpful is aging is one lens that's really easy to help us actually understand many accessibility issues that other populations face. So if you can apply a lens of looking at things through an older adult, you're actually also meeting many other populations' needs. So I think those are just a couple of thoughts that I think about when I think about barriers to technology. The other ones are the obvious, whether or not someone has Wi-Fi access in their home, whether or not they have high-speed internet and broadband just in their area in general. So the geographic differences as well. Living in Colorado, where in many parts of our state are still, not able to access broadband as well. So those are other barriers I can think of. But I'll let the other panelist go as well.
Yeah, I'll add on to that, and I think you're right. And it's font size, it's font color, it's making the screens intuitive, making them understandable. I think some other things that come into play, and I'm sure this has happened to many of us. You're trying to get into a WebEx. Imagine being a senior, you're trying to get onto your telehealth visit, and it's not connecting, or something's not happening, or the physician is late. And it creates a tremendous amount of stress. So, and everyone's using different platforms. So it's something to think about with that as well, and making sure that they're comfortable and understand, don't have stress about it. I've seen it happen in my own family. It's understanding devices. I worry about, as people age and there is some level of cognitive decline, will they be able to keep up with the pace of the change of the technology? Think about, as recently as this past summer, my father contacted me via text. He couldn't hear his phone. His phone didn't ring. It didn't give him any notifications. And so I had to, text him back and say, try this, try this, try this. He had somehow put the phone on silent, the little button on the side of the phone. but he didn't think of that. Or he is going into some level of cognitive decline that didn't cause him to think of that. I know I've seen it even with updated versions of, say, Word or Excel. I think back many, many years ago when Excel changed and I couldn't find the set print area. And I was calling all kinds of people, all of my friends saying, where is set print area? And they said, when you find it, let me know. So it's things like that that you need to think about. And then again, virtual is not for everything. So understand the limitations. It is not for everyone. It is not for everything.
Yeah, I think your point about caregivers is really interesting too, because again, when I make the point of designing for all rather than designing for specific populations, right? You may have many instances in which a caregiver is acting on behalf of a person, but you want to make sure that it's done in a way where it still brings the person into their own care as much as possible. So I think that's always an important consideration when we think about the caregiver aspect of this. Sorry, cut you off, Carissa.
Well, I would be curious if anyone else has heard this kind of feedback, but we also often get, I feel like this, the notion of sort of retailization of the healthcare experience has been sort of something that has been coming up. And I know we've been asked frequently, is it too big brotherish? So the idea of it's okay if I log into Netflix and it tells me I want to watch that new Inventing Anna show. Like, it knows that that's what I want to do, and that's the show that I want to watch. And for me, that's a really great experience. But, sometimes when you think about being predictive in that same way in the healthcare space, that can feel a little icky, so to speak. And so I think there's still just some general kind of concern in that space. And I think just as more and more members have a positive experience of their health plans, be getting to know them better and sort of anticipating their needs, I think that'll, reduce. But that's also been something that we've heard. It's just, this feels a little Big Brother-like.
Excellent. Thank you, panelists. Let's take another one. There's a lot that have come in. So all right, they keep coming through. All right. Okay, there's a number of them. Hopefully we can get to these. Here's a one on real-time versus traditional data collection methods and providing some insight on what type of data is collected in real time versus.
Yeah,
anyone.
I take the first stab at that because it's interesting. We recently met with a health plan, and they actually gave us feedback saying like, "Hey, you talk about this real time data, and that's almost like off putting to us. We're not getting the data in real time." And so I think a lot of what we think about in that space is how do we reduce the time that it takes the plan to see the information. So I think we all know that you're going to have a claims adjudication lag, but how do we start to think about what is other data that one may be able to get more timely? So maybe your pharmacy data only has a 30-day lag versus a 90-day lag. And what can that tell you about that individual? Plans may be collecting health risk assessment data, and that's data that as the member is telling you that, you can really, I've seen a lot of great clinical platforms that can begin to build out sort of care plans based on that. So I think it's more about, looking at the industry challenge of the data that we get isn't always real time, but looking at what can we do with the data that is. We see a lot of health plans using their authorization data or their data to know way before that claims dropped that person had a hospital stay. Social determinants of health data. We see great clinicians and care managers capturing that in their telephonic conversations. And let's listen to those calls, apply natural language processing and push that out as opposed to waiting for a Z code to come back if it ever comes back. So I just think it's sometimes thinking outside of the box to identify how to just make that more timely so that we're not reaching out to members and saying, a month ago, you told us that you were feeling down, depressed, and hopeless. What do you want to do about that? We want to capture that right then and there when you have that person and they're really expressing that need. So I guess that's my initial thoughts on that.
I'd just say there's a lot of devices out there now, smart devices, and this sort of gets back to the big brotherish. But for some of the most vulnerable, there's devices out there that can determine, sense activity within the home, sense activity, has the person used the bathroom today? And so it can send alerts if something is going awry that is not the normal pattern for that individual. I think those things are important. Of course, all of the digital monitors for diabetes and those things can send reports, digital scales, blood pressure cuffs, can send reports to physician practices immediately if something is really off the rails and get someone back on track quickly and hopefully without an inpatient event. So I think those are things that we will see more use of. Again, I think it's going to take a little bit of time for people to be comfortable with the adoption of somebody's watching me, so to speak. But again, I think those things we are going to see more of that in the years to come.
I completely agree. And I think what we think about in that context is flipping the script a little bit, in that it's not a big brother. It's actually enabling agency, right? Many people, if you try and come at the topic of this is allowing you and giving you the individual agency and power to stay in your home longer, to keep yourself healthy longer, I think that's where people then start to come back off of the, I feel like Big Brother is watching me, and this is actually helping me keep care of my own self. That's a way that we really try and talk about these issues. The other one is being very transparent and open about the privacy and the protections that are being put into these systems, and not just what's being put into the system, but what happens if that system fails. Being transparent about the protocols that happen once something does fail actually helps people feel more comfortable. I think sometimes we have a tendency to think, well, if I give them more information and I set them up with scenarios of, well, if it fails, it would do this, that makes them think, it's going to fail one day. But that actually helps enable trust amongst many people from our experience.
Excellent. I think we can tackle maybe one or two more. I'm going to paraphrase this next one because I see a couple that are along this line. So we're talking a lot about technology adoption. So what about engagement? How do we encourage continued engagement?
I mean, we do a lot of communication with our customers to make sure that they know what's available to them and how they can learn to help themselves, how they can utilize telehealth visits to access care and make it easier for them. So it is, constantly educating your customer base, educating your sales force and your brokers, making sure that it's easy for people to utilize, educating the caregivers and the family members of what's available to them as well, educating the physician providers. Again, I mentioned earlier that we now have physician groups that are promoting our telehealth services. It helps them as a sort of a wrapper for after hours care for them and relieves them, but makes sure that their patient base is taken care of. So I think it is, going to be continued education. And one time is not enough. It's got to be front and center a lot and frequently until it becomes the norm and becomes the expectation.
I think it's also, I completely agree with all that. I think it also is giving people a forum for getting their questions answered. And again, as I said in my earlier comments, that is not just an issue that older adults face, right? This is not just a Medicare Advantage issue. This is anyone operating in the healthcare system. They just want the basic access of, can I call someone and talk to a person live when I have a question? One of the things that drives me most nuts about Verizon Wireless is they bury their phone number as deep into their website as possible so that you use every other source of connection with them in order to actually talk to a live person. And I think we see the same thing, and in some cases it's often worse in the healthcare setting is, it's really difficult for a person to just connect and say, I have a question. I don't know how to open the text box in this app that you're having me use. It's a very basic question that takes 5 minutes to answer, and a person can answer that in no time. So I think that's just a very basic thing that we see as a need that, again, any population really cares about, not just an older adult population.
You both said things that resonated with me. Christine, when you mentioned brokers, just thinking about listening and paying attention to our members' behavior. So did they enroll online? Did they enroll face-to-face in a meeting with a broker? Or did they do it telephonically? What does that tell us, that very initial interaction? What does that tell us about probably how they want to continue to interact ongoing? So listening to that, paying attention to that. And even though our internal processes may be, we call you for a welcome call. If you went online to do it, you may not want that phone call. I know I was a telephonic health coach forever. I hate the phone. Like, I don't get my nails done anywhere that I can't book it online. And then Claire, that is so true what you were saying just about ease of access and making sure that all modalities are available and transparent, because lots of people do. They want to call in. They want that kind of high touch interaction. Some people, like myself, I'd rather figure it out online. So I just having those all available, and then listening and paying attention to that, and taking cues from all the way, from back when the person is shopping for a health plan and how they did that. Both of those thoughts.
Carissa, I think brilliant statement. Ask people, right?
Right.
What's your preference? And then go from there. I think that even just that basic question is often forgotten.
Totally.
Excellent. There's a number of it. Let's take this one more. We'll take one more, and then we're gonna wrap. Hopefully this one's in a couple of questions, but how do we address patients with low health literacy? So we're really specifically looking at low health literacy, and are there any words of wisdom there, or special ways to address those particular patients?
I'll take a first crack at this one, because it is really, as a social worker, like, it's really meaningful to me. And when I worked at a plan, I don't know why I didn't think of all of my social work best practices. But one of the things that we found is, and even I had this happen to me, I'm a telephonic case manager, and I'm calling this member. Meanwhile, they have a community health worker who comes to their house every day. They might have behavioral health services in the home. That is their trusted advisor. That is the person who they have that trusting relationship already built with. And so I think sometimes knowing who's involved in that person's care and who's going to make them feel the most comfortable talking about topics that can be very, make folks very vulnerable and be very private and personal. I think almost it starts with who is delivering that message, because then they can do exactly what you said, Claire. They have that ability to ask that. And they already have that trust established. So I think it's really important to just look to the community as well, and meet the member where they're at with the person with whom they're really comfortable, because they know how to communicate best with that individual and what works and what doesn't. So it's not a one size fits all or a magic bullet, but who interacts, I think, it can be really important.
Yeah, it brings up some research that we've done, and I mentioned it, I think, in my notes too, about how health plans, and we've looked at both health plans and health systems, how they're approaching tackling their members, their patients and members, drivers of health. And I said drivers of health, not social determinants of health, because social is just one aspect. Environmental, economic, those are also major drivers of a person's health outcomes. And we looked at, what are health systems and health plans doing to connect members to community organizations? And I think, Carissa, you nailed it on the head there. I mean, community organizations know how to talk to people. They know the populations that MA plans are serving better than the MA plans themselves. It takes a lot of work, because every community looks different, and there are networks of community-based organizations, but it's really a much more manual process. But I think we are seeing a lot of interesting examples. Again, Healthify was one that I talked about in my notes, of organizations that are trying to digitize on top of what's already happening in the community, right? So it's not replacing, but it's adding on to and adding the digitization to what's already being done in the community. And I think that can really make a large impact. You talked about your background. I hadn't talked about mine much, but before worked in this research space, was in aging services in very rural county of Northeast Georgia. And the population there looks very different than every other population in the country. And so understanding those people's needs and what builds trust in a relationship, I think, is also another really important part of this. And having people who not only look, but also talk like them, use the same language, even the same dialect, can often really make a world of difference.
Yeah, and I think you can also, I think plans can also utilize their care management staffs to help people understand what's available in their communities. I do like the idea of digitizing it. There are some systems now that we use that help us understand what's available at the community level. So even if our care management staff, let's say our care management staff's based in Tennessee, but they're talking to someone who's maybe in Georgia, they can help identify what are the resources available to that person in their community. So I think there are so many great ways you can go at it via the National Council of Aging sites. They have a tool on their site. You can use Aunt Bertha. That's another site that can help people find resources. But getting people connected and helping them connect in with groups that, again, look like them, sound like them, that they can, use as trusted advisors to help them, I think is really the way to go after it.
Excellent. Thank you. We have just a few minutes left, so we're going to have to wrap up, but there's a lot of good questions in here, and especially if they're specific to someone, we'll do our best to try to return to get back to you on some of these questions. We'll keep a hold of them, and we'll see if we can get back via your registration. So in closing, thank you for attending the Fierce Biotech webinar. Healthcare, sorry, we are not in biotech. We are in healthcare. The Fierce Healthcare webinar, and submitting so many great questions. I'd like to thank our speakers for participating today. Great discussion, really great discussion, and Untitled Health for sponsoring today's webinar. So addressing a lot of these questions in this queue, this webinar has been recorded. So you'll be able to access the recording within 24 hours using the same audience link that was sent to you earlier. So you can just go back to that link. It'll be about 24 hours. So thank you again for joining us, and we look forward to seeing you at future events.